Now we move to our fourth speaker, probably the most senior amongst us. Dr. Teepu Siddique is from Chicago. So first of all, thank you very much. It's early morning there. आपका बहुत शुक्रिया आपने जो है वो सुबह सुबह का टाइम हमें दिया, डॉक्टर साहब. You are from Chicago और माशाल्लाह you are a physician scientist, I would say. And आपका तारुफ तो बहुत लंबा है, लेकिन you work at the Northwestern University Feinberg School of Medicine in Chicago, and you are a ALS Foundation, Herbert C. Wenske Foundation Professor. और आपके जो different departments हैं, माशाल्लाह, जिसके अंदर you work in pathology, so you can explain further. And I know a few of your students who have worked with you, so you work on the gene side, but you're also a thinker. तो हमने कुछ सोचा आपसे कुछ सवाल ऐसे करें कि जिसमें आप इन तमाम चीजों का अहाता करें, डॉक्टर साहब. So I will start with the question that were we ready for the coronavirus? Looking at some recent not pandemics maybe, but endemics in the some years ago. So was our health system preparing for it, or we were just
I can't hear you. You're breaking off.
अच्छा, shall I repeat myself? अब आ रही है आपको मेरी आवाज?
No, you're still breaking off. Could we?
Okay, I will repeat myself.
Okay, now, yes, fine.
Okay, great. So my question is that were we ready for the coronavirus? And looking at some of the recent endemics in the world. और दूसरा ये कि जो physicians or researchers थे, did they do justice when they were talking about hydroxychloroquine and other treatment modalities? Was it evidence-based, as अभी Dr. Sohail bhai ने भी बात की कि are we practicing evidence-based medicine or not? So was the response by physicians and researchers evidence-based? जैसे मैंने पहले कहा, is the science around COVID-19 also changing? And I want to ask you a little bit about the role of resilient leadership, governance, especially since you come from the US, and we've seen the role of the leadership in the US. And I just saw a news that Trump has said that I'm still taking hydroxychloroquine, and here I am. That's what he said. So, we would love to hear what your thoughts are on all of this.
أعوذ بالله من الشيطان الرجيم. Alhamdulillahi Rabbil Alameen. Salatu wa salam ala Rasulihil Kareem. Dr. Zakiyuddin, thank you very much for inviting me. And so it's a long story, as you know, but to make it short and sweet or bitter, nobody was prepared. I don't think there were few, even after the first patients, and it became obvious through epidemiologists and scientists that this has a different track and was moving very rapidly. No preparation was made at the hospital level. No preparations were made. There were a couple of exceptions, the hospitals, that they acquired their PPE and so forth. The PPEs were being exported, but they were not being stored. And the government at the federal level completely failed to recognize the extent of what was coming through. And this is not something new. There were a lot of popular books that had been written through the years, even before the 2002 SARS and then the later MERS epidemics, which were contained. So it was not something that was unknown, but in the sense, this is like a black swan event where you look back and you say, oh yes, we should have known this. So I think it's an implosion of the corporate political system as well as the corporate medicine system. It's an implosion of what people have been running with as a model for taking care of people, healthcare. So this model has failed. And I think that's a great tragedy because a lot of people have lost their lives and become sick and the economy has failed. So I think going forward, I think that's at the end of your discussion, there will be a lot of talk. Whether there'll be new social contract, I don't know. Looking back to the 1918 pandemic and so forth, it resulted in the roaring 20s. And people didn't really reform, and then they went on to have their Great Depression, and then they went on to have the Second World War and all kinds of atrocities. So I don't know if humankind will learn, but we were not prepared because of very simple thing. One simple thing is that the Prophet taught us about quarantine. And quarantine is in other cultures also. It's very clear. You do not leave and you do not enter. But in Pakistan, there was entry from Iran first that seeded the entire country. And then from some other places, Saudi Arabia, and then there was congregation of people that allowed that to spread. That was a clear violation of what we know to be fundamental rules of quarantine, but also very clearly told to us by the Prophet. So we ignored both. We ignored scientific knowledge, epidemiology, and what was handed down to us through our tradition. So that's a human problem. And I think that brings up to the issue that what is this? Is this the wrath of God? Or is this some sort of a escaped virus? Or is it a synthetic virus? Well, none of them, in my opinion. First of all, if you look at the mutation rates and if you look at the changes that allow a virus to become more effective in infection, and you can predict that by computer models, that has not been seen in the sequence of this virus at all. So it's highly improbable that it was synthesized. It would have been a different kind of a virus if it was synthesized. Second, did it escape? You know, BSL-3, unlikely that it escaped. More likely is what has happened over the centuries to humans, which is zoonosis. There are 200 some coronaviruses in the bats. The one that we know about, there are 6 of them now that infect humans. This is the 7th one. 4 of them are common cold viruses, but occasionally they will cause severe bronchiolitis or pneumonia or even death. Rare, but happens. One of them came 1,000 years ago from bats to camels and to humans. Another one came about 100 years ago from cows to camelids and so forth. So it's not a new story. We know about cowpox, we know about smallpox, we know about all these things. We know about naivety and of the immune system, as happened in North America with 90% of some tribes who died from introduction of European individuals who brought with them smallpox and measles. And so all that is known, and yet we fail to act. And I think that sort of tells you our blindsidedness about what is important in life. And I think this lockdowns in many of these countries, including the United States, has shown the superfluous activity that we indulge in instead of the essentials. And so I think that'll be a moment of thought as to think what is essential in life to go back. Now, our lifestyles, you know, clearly this is hugely a problem of concentrated individuals in urban environments and in closed sanctuaries, you know, when a lot of people get together and when they talk and when they shout and they scream or they sing or whatever they do, but if they're close enough. There's a saying in America that, you know, your freedom ends where my nose begins. But now the thing is that your nose is 6 feet long and it's interfering with me constantly. And so I think that's something that that needs to be understood as to where your freedom actually now begins. As far as specificities of preventing this disease, we have some information. It is theoretical information. And that information is nutraceuticals. You know, this paper that came out in Progress in Cardiology, it lists 1, 2, 3, 4, 5.
थोड़ा सा ऊंचा बोल सकते हैं please?
It lists about 9 of them, and these include beta-1 interferon, and that's the first line of defense in viruses. You know, viruses viruses are responded to by the TLR system and other systems, then you have increase of beta interferon and you have, you know, clearance of the virus. And these include some ordinary things, you know, things like black elderberry syrup and beta glucan, which is present in many cereals, selenium, glucosamine, N-acetylcysteine, alpha lipoic acid, and so forth. So, I mean, fortifying yourself with this makes sense. Same thing is true with vitamin C. It's an antiviral drug. Intravenously, it can be effective. But the problem is the absorption of that vitamin C is limited because of the transporter. So once you go beyond 250 to 500 milligrams 2-3 times a day, it becomes a problem in terms of increasing the dose and absorption. But these are there. Now, one of the things that wasn't mentioned was the endothelial damage that is done by this virus, because there are viral receptors on the endothelial cells. And once those are disrupted, you get release of the von Willebrand factor. And that comes out in packets, that are completely wound up. And once they're released, they become like an open reel of thread. So it spreads and entangles the elements in the blood, and you get a clot. You get microemboli, you get large clots, you get strokes, you get heart attacks, you get all kinds of deep venous thrombosis. So, and that is cut by an enzyme that requires zinc. So zinc turns out to be an important issue, both in the free form that is running in the blood, but also into the cell. So zinc, if you get enough of it into the cell, it inhibits the replicase enzyme, which is the polymerase-dependent polymerase of this virus. So if you can get enough zinc in vitro, you can see that the virus will not replicate. But it will not get in, so you need an ionophore to get the zinc in. And there are things like quercetin, there's, present in onions and so forth. And then there is, extract some green tea. But if you take hydroxychloroquine or chloroquine, it opens up the zinc ionophore and allows the zinc to enter. So there is a great theoretical possibility that this is one mechanism if you take the drug by zinc. And now a recent study suggested, again, it's a retrospective study, that by doing so, you can improve the chances of survival of people using both the drugs. Now, the problem is that we don't have any controlled trials, but hydroxychloroquine has other means. As a muscle pathologist, and we look at hydroxychloroquine and chloroquine toxicity, and you get this vacuoles that develop and so forth. So it interferes with the acidification of endosomes in the cell. And so if the virus enters, once the spike protein binds to the viral receptor, it has to be internalized, and it goes into the endosomes, and it has to be alkalinized, and then it is released. Hydroxychloroquine and chloroquine interfere with that process. So you have a number of ways in which hydroxychloroquine and chloroquine may theoretically act as an antiviral drug. So we don't have, now people have used them at the end of life. We know that even from Tamiflu, that if you use it after 48 hours, it's not effective. So you have to know when to use the antivirals to clear them out. N-acetylcysteine interferes with von Willebrand factor. It activates the antioxidative stress, and it activates beta interferon. So N-acetylcysteine, I think, could be used safely for most people. It had been used in pulmonary medicine when I was a resident, when it was given as an inhalation because it breaks up the sulfhydryl groups between the mucus, And so I think that's something that, if available, people could use prophylactically. Now, there's a study going on with hydroxychloroquine to see with 2,000 patients. These are relatives of somebody who has a definite involvement, definitely positive COVID test. So I think there are lots of possibilities if we exercise what is known. There are lots of drugs that are being repurposed and have been tested in silico to look at how they bind to the spike protein or other activities. And that includes things like riboflavin, famotidine. There's a drug that interferes with the viral transport into the nucleus of proteins into the nucleus. It's been used as a anti-parasitic drug, ivermectin. So huge possibilities of doing trials and testing these things out. Which brings up to the question you raised is about evidence-based medicine. Now, I have a personal view about evidence-based medicine, in which most people will not agree, and that is it just sets the goalposts for a situation. This is a drug pharma-based exercise, and we are fooled and teach our residents that this is a great thing. It's not a great thing. It just tells you the goalposts, because humans are individuals. The genetic makeup, the genome of each individual. The chances of another person being like that is like 1 in 1 trillion in the universe. So personalized medicine is absolutely important. In America, senior, experienced, intuitive physicians and have been either removed by corporate medicine or in the process of being removed because they can get younger people who are cheaper. And everything is on the web except experience and intuition. And hopefully artificial intelligence will help us there. But right now, it's so important that we exercise scientific judgment and experience in treating individual cases. As you can see, as I described very nicely earlier, that the disease is not just an infection of the pulmonary system. It has this delayed cytokine storm, and it has the delayed endothelial disruption, which leads to all kinds of problems and failures that occur. Now, the highest concentration of the receptors are in the GI tract and in the pancreas and the beta cells. So you can expect, there's a paper just now that came out about hemoglobin A1C and how it correlates as an association in a linear fashion with outcomes in this disorder. So I think there are lots of clues out there that we need to assemble and work hard to try to make sense of in a collaborative way. And that's one of the beautiful, good thing that has happened out of this is there's great collaboration going on among scientists across the globe in spite of this territoriality and this idea of national science and those sort of things that are being put out by the American leadership. I think
Right.
That's a non-starter and it should not be. I don't know if I missed something that you had asked.
No, I think that was a very, very elaborate response, and at least I'm more educated after this response.
So if I may, just 1 second
Please.
about the vaccine.
Gee.
There is a Pakistani scientist, physician in Lancaster, University of Lancaster, and he is onto that development. And what I have been told is that he tried to contact the government but has been unsuccessful because the other vaccine from Oxford is coming for testing to India. So I think that's something to take into consideration if Pakistan is to become a participant in this process.
Sure. Dr. Teepu, आपकी तरफ मैं आ रहा हूँ और since हमने आपको इंट्रोड्यूस हमने आपको कराया इस तरह कि you are a thinker माशाल्लाह, और अभी आपकी जो गुफ्तगू थी वो हमारे लिए बहुत यूजफुल रही अल्हम्दुलिल्लाह। जो मैंने शुरू में कहा था कि I pray that this conversation becomes meaningful. ये जो हम घंटा सवा घंटा इसमें इन्वेस्ट कर रहे हैं इसका इंशाल्लाह हमें फायदा हो। मैं आपसे ये जो 2-3 चीजें पूछना चाहता हूँ कि is there opportunity in this calamity? Number one. दूसरा, क्या मेरा गुमान ये था और अभी भी है इंशाल्लाह अल्लाह ताला की ज़ात से भी, और कि इस कैलेमिटी में से शायद जब हम निकलेंगे तो हमारी जो हेल्थ केयर है it will become a priority not only for the government or the policy makers but also for individuals also. But इस पे मैं चाहूंगा कि ये दो चीजें, is there opportunity in the calamity और क्या हेल्थ केयर वाकई प्रायोरिटी बन पाएगा इस के बाद, और a little bit few words on what is the new norm. अनम्यूट कर लें प्लीज, और थोड़ा सा मैं आपसे कहूंगा जरा ऊंचा बोलिएगा प्लीज।
जी।
थैंक यू।
One thing I want to say is that all that I have said and will say is my own personal opinion, and it doesn't reflect the people, my employers, Northwestern University or Northwestern Medicine, just to get them off the hook. So one is a macro issue. Macro issue, it concerns all of humankind. In the winter in Pakistan, there were studies done many years ago from satellites. The inversion that comes from China and from Eastern Punjab and other places in India, it sits on Pakistan, also sits on India. And that inversion is what you see with disruption all through the winter in Pakistan with the fog and smog and all kinds of stuff. So that's a macro problem that affects entire mankind. And the climate change deniers, they continue to tell us that there isn't any such thing. But we know that when you invade the spaces of animals and you deforest, you get the infections of those animals. When you rear animals as factory farms, as we are doing now in Pakistan with chicken, but all over the world with pigs and with cattle, you produce severe stress in those animals. And when you bring those animals which are neither tayyib nor halal, and you sell them to people in those markets, as in China, as Southeast Asia, then those animals are under extreme stress and their immune system is not functioning. That's when that virus multiplies in those animals and then passes on, because each time it multiplies, it doesn't have good editing system. So it produces lots of variants, and some variants are more effective infection, some are less. And finally, you get one, that is latches on completely. For example, if you look at this particular virus, the spike protein fits into our receptor very well, but also to the macaque monkey, and to less extent to the cat and dog and rabbits, and probably hamsters. I'm not hamsters, but some other animals. So that's what happens when you invade the spaces of other creatures that God has created. So we have to know our limits of how we can exploit our environment, and to what extent and in what way. It cannot be laissez-faire, just because we will have more of these disasters. There's this NGO, Eco Health International. I don't know I think it's supposed to be working in Pakistan, because they were surveilling through the Defense Department of American Defense Department, looking at emerging risks, biohazards from bats and other places in Central Asia and so forth. So we know there are at least 200 such viruses in bats, the coronaviruses itself, and they fly at high temperatures, and they probably, when you bring them and they cannot do their activity, then all these things happen. So that's the macro thing, that people must learn to think in different ways of how they're going to run this planet. So for Pakistan, I think we have to think in radical terms. And I think the government either is not available or able or have the resources to do this, or just the organization that is required. And I think it may fall onto non-governmental organizations and people of conscience and physicians, that the Pakistani elite must stop going to restaurants and spending thousands and thousands of dollars on their food while their driver sits out there and wonders where is all this money going. And you saw all this rush that went into these designer clothes and those sort of things. There has to be a turn towards simplicity of life, and to recognize the essentials for life rather than the superfluous stuff that people have made into important things, whereas a large part of the population suffers. I think this has made it very evident between the haves and have-nots and their different, what their goals are and what are the goals of the common population. So I think one way to think about this is sort of utopian, but I think it may prepare us for the future. This is one crisis. There will be more, and maybe worse. And there will be crises from your neighbor who is your existential threat. They may cut off your water, either from the north, or in Karachi, you'll have millions of people without water. So I think we have to start at the Union Council level and know exactly who lives there, what do they do, what are their incomes, what are their sources of life, where do they get their water, where do they get their food. You know the three threes. 3 minutes, you need oxygen, otherwise you're dead. 3 days, water, if you don't get it, you're dead. 3 weeks, you don't get food, you're dead. So think about Yusuf alayhi salam. The king had a dream. It was information of some sort that he interpreted. We have lots of information. We have seen SARS, we have seen MERS, we have seen Bangladesh, we have seen so many things. And if we don't take heed from that dream, that nightmares, and prepare, then we will suffer again and again. So first thing is water. In Karachi, you can extract the water from the air because of the night-day temperature and the humidity. So solar power, it's not very expensive. It can be done at the mohalla level. It'll end the monopoly of the water mafias. Then you have to store food in the form of grain, because if you store things otherwise, then they go bad. But grains can store for a very long time. Same thing for medicine, health, education. But if you don't have the basic data, you cannot start. But I think that's where it has to start, at the very local level, at the Union Council level, to make each area self-sufficient in times of crisis, and to educate people about what the priorities are. And it seems to me that they're lopsided. So that's the wider issue, and the micro issue of as to what can be done. We need to train our people in the material sciences as to how the world works. That is, starting from school children. In my opinion, God has two things. One is his creative will, which is the laws of the universe which do not change. And we have to learn those. Anyone can learn them. You don't have to be a Muslim to learn them. Biology and chemistry and physics and whatever else, material sciences. And the other is his legislative will, which is the revealed will that we believe in. That is how we deal with other people, how we conduct ourselves. So I think that's with these two things have to be focused. They have different and separate areas of operation, and one defines the other. So
finally, Dr. Teepu, your words of wisdom. What has this taught us? और अगर आप कोई 2-3 pointers अगर मैं दे सके.
एक तो मोहम्मद इकबाल का शेर है जिसे हमने यानी कोशिश ये की है कि उसकी पूरी हिस्ट्री को ही मिटा दें पाकिस्तान से. सूरत शमशीर है दस्ते कज़ा में वो कौम जो करती है हर ज़मां अपने क्या है वो रीअसेसमेंट कि हमने क्या किया है और क्या करना चाहिए उसकी. Then you become the means of dictating your future, writing your future. So unless we investigate, this is a big part of medicine is investigation. And we have all remained what the British taught us, which was to be these trade schools. We know how to use the stethoscope, we know how to use the scalpel, we are very good at that. How to listen to this, that, and the other, and the new technologies somehow, which is good. But we really need investigators. So we have to train a cadre of physicians and others who are going to dedicate their lives to solve small problems. Very important ones, but small ones, and then get together to solve bigger ones. Because it is the subspecialists who advance medicine, scientists and physician scientists. So that is one lesson that we should learn from this. Second is that you have to be self-sufficient in all the basic requirements, which include health and education. But most importantly, to train people and medical students and residents, not just to cram what is in some book, but to understand how to solve problems. And once they know how to solve problems, they can apply the techniques that are constantly changing to make that happen. Finally, I just didn't mention vitamin D3, and that may be important because in the Nordic countries, they use cod liver oil and other things, and vitamin D. It can only be gotten from the sun or from supplements. You can't get enough from the food. So that is something to consider, even though there are no controlled trials for that. So I think it gives us an opportunity to prepare in the long run and in the short run to train people, shift priorities. There must be a campaign to shift these materialist properties, priorities that pervade society now. You know, as I had mentioned, I was appalled to see the tens of thousands of rupees are spent to go for a single dinner while people beg out in the streets. That has to change. And I had proposed that, if you really want to help people eat one meal a day, the wealthy can eat one meal a day, will be healthy. There was just a paper out in proteomics 2 days ago, which they took 15 Muslims in Baylor University, and they tested 14 hours of their fasting, and they looked at all the markers for immune system, for cancer, for diabetes, for Alzheimer's disease. All had improved, many, many fold. So God does not make us do things that are bad for us. It is we who think it is bad, and we do bad things, and he says that all the evil is from you. So when we invade his creatures' spaces, we get those viruses. We should not blame it on God, what our hands have wrought. So people are blaming God, the azab-e-khuda hai. तो हर चीज अल्लाह के हुक्म से होती है, उसके इज़्न से होती है, लेकिन ये तो आप खुद कर रहे हैं, ब्लेम उनको करते हैं।
ठीक है डॉक्टर साहब,